And our next speaker is supposed to be Dr. K.S. James, and unfortunately he couldn't be here. But one of his lab members, Dr. Babul Hassan, is here. He is a postdoctoral fellow at Luxembourg Institute of Health. He has a wide range of experience in working with large-scale data sets related to aging in India, including longitudinal studies in India, LASI, and studies on global aging and adult health. Dr. Babul Hassan.
I will try to deliver what James sir intend to present in this forum. But before that, I would really want to thank last two presenters because they talk about genomes, genetics, biological aspect of longevity and health. And that's it to talk about the social aspect of health. I'm going to talk about the mortality for widowed population in India, and particularly going to talk about how household dynamics, particularly in India's changing family demography, can do matter. And I will try to bring how economical hardship that can play some important role when we do talk about older widows' mortality. But let's give you a brief background what is happening. So whether it is global north or it is global south, we will find a persistent gender difference in mortality. Now, as rightly said in the last two presentation, that the genomes, genetics part, those things do matter, and even Harvard Research Labs, they established that for women, because of their genetics and genome, they are actually living longer. They have better survival chances than men. That's the reason we often find a lot of the women in the later ages, more and more of the women in the 60 and plus age group. And that is the reason we can say that there is a feminization of women or in the later ages. But one thing we must look into that, if we bring the civil status in that, we will find most of these women are widowed. Almost half of the women we will find being widowed in the later ages. And that is the reason Davidson coined the term feminization of the widowhood in the later ages. If we look the Indian scenario, as per the Lumba report, there was almost 245 million widowed women in world, and India alone accounts for 17%. The latest census, the 2011 census, rightly mentioned that there is a huge number of widowed women in Indian demographic. Almost 43 million widowed women are there. And if we go by the age group, almost 48% of the women who age 65 and above in India, they are widowed. And it is significantly higher than men counterpart. Only 8% and 15% men who age 45 and 60 being widowed were there in 2011. And that makes widowhood is most prevalent civil status among women in later ages. And this is not the end, because the 2050 projection for widow population also highlights that we expect to have more and more number of widowed women and widowed population in Indian demographic. But the discussion can be stopped here. But we must acknowledge that widowhood has a long history. There is social, economical, and health-related disadvantage which are being documented globally as well as in India, which suggest women, particularly because of their widowhood status, suffer more. If we look at the recent evidence highlighting the economical aspect or food insecurity related aspect, we will find more and more of the widowed women, if they are heading the household, they are at the poorer economical status. The mean income, the mean annual household income, has been found to be a bit lower among the widowed headed households if they are women. Even food related insecurities have also been found more among the widowed women compared to their men counterpart. Even if we do look at the health aspect, whether it is physical health, mental health, or even the perceived health, we will find that older widowed women, they are actually suffering more. For example, the recent LASI data for 2017-18 highlighted that if a 60 and above older woman is there, then she has almost 3.7% more multimorbidity, 4.6% more self-reported health, and 2.4% more depressive symptom compared to their marital counterpart. And it is interesting because why a woman being just widowed should suffer more. And although these are being now tested, Indian literature on focusing on social aspect of health is actually try to delve into that, try to understand why this is happening. But one of the key components is still missing in Indian literature, that is widowhood effect, a well-known phenomena where just because of widowhood, individuals experience high risk of mortality. Although globally this phenomenon is well studied, but still in Indian demography, this aspect I will say has received very little attention. Sorry. Although one of our senior professor back in 1994 tried to highlight this issue, he find that almost 70% high risk of mortality for widowed men and women in India, but there was no prior study which actually tried to explore the mechanism of mortality disadvantage, particularly for women, because women always have this familial socioeconomic disadvantages because of their marital status in the city. Why we want to talk about then household structure and why does that matter in Indian context? So if we look at the 2011 census data, we will very interestingly find that just because of widowhood, women are coming into more into the picture. They are actually heading the household more just compared to their marital counterpart. Compared to married women, widowed women have to lead their household more. And this story again stretches. If we go by the gender role theory, it clearly emphasizes that women's household status matters in terms of their socioeconomic and health outcomes. Even household headship actually denotes the authority and control over the household resources. If a individual who's leading the household and also have the authority to control the resources, possibly the relocation of the resources also being dictated by him or her. And that is the reason often a older widowed woman who is living in a household headed by different type of individuals may get the different type of or different way to resource allocation. The second dimension must be acknowledged is that in Indian sociology or Indian social dynamics, older widow represent a symbolic power. This term actually raised by the Martha Chen back in 90s, 80s and 90s. She said that if a older widowed woman, she is properly taken care, she received proper attention from the other household members, then that older widowed woman can represent a good family. However, if a older widowed woman, she doesn't receive proper like responsibility, or if she just left on her own, then in most of the cases that older woman represent a bad family. And given that background, we want to test in the changing family demographical context in India, does household headship matters in mortality for older widows? And how further the financial hardship can alter the relationship between the household headship and mortality for the older widowed woman. So this graph actually highlights the age-specific death share by the household headship for widowed women and for the married woman. And we have classified widowed women in three broader groups. That is widowed living in a household headed by themselves, widowed who are living in a household headed by the children, and widows living in a household headed by the others. So other includes those who are their in-laws, their brothers, or their nephews. And we very clearly find it that widows who are living in a household headed by the others, that means the extended family members, brothers or in-laws, they actually have higher mortality compared to those who are living in a household headed by themselves or by their children, and even higher than compared to those who are married. We also want to test whether there is a financial or economical component in it or not. So we hypothesize that if a widowed woman, she expected financial support from anyone or particularly from their son, then possibly that widowed woman actually have financial deficiency or experiencing financial hardship. And interestingly, we do find those widowed women who are actually expecting financial support from their son, they're actually dying more compared to those widows who are not expecting financial support from their son. Further, we try to intertwine these two aspects. We try to see how household headship and financial hardship, these two can link to predict the mortality. And very interestingly, we find if a older widowed woman, if she actually she is the head of household and also expecting financial support from their son, then possibly in the most cases, she will have higher odds of mortality compared to her counterpart. That means if a older widowed woman, she is head of household and not expecting financial support at all, then she has lower odds of mortality. The same scenario has also been observed for those widows who are living in a household headed by their children and still expecting financial support. Interestingly, we didn't find any significant association between widows living in a household headed by the others but expecting financial support from the son. And it is going against the hypothesis, because we started our analysis with this assumption that possibly widows who are living in a household headed by the others will have more financial or economical related hardship, and possibly if they have that, they will expect more mortality or mortality related disadvantage. But in our data, we didn't find that. And in other way, actually, we find that widows who are living in a household and also having the economical hardship are actually at high odds of mortality. To understand better, we do had a heterogeneity analysis. We try to classify the widows living in a household in poorer setup and non-poorer setup, and we clearly can find it is the widows who are living in a household headed by themselves and expecting financial support if they are coming from poorer background. That means if their wealth status below or at the bottom level, then possibly they are actually experiencing higher odds of mortality. However, this association completely get diluted when we focused on widows living in a household headed by their children, or widows living in a household headed by the others. So the subsample analysis actually continue to hold our hypothesis that household headship to reduce the odds of mortality. But if, or in this scenario where we don't have any financial expectancy from the son, that means they don't have any financial hardship or experiencing any economical crisis. So what we want to conclude that our result indicate initially, if we don't control anything, that widow, if they're living in a household headed by the others, brothers, son-in-law, grandson, or extended family members, then they will possibly experience the high mortality ratio. However, upon the introduction of financial hardship, it completely changes the dynamics. Further on, analysis very clearly suggests if a widow experiencing financial burden or hardship and living in a household headed by themselves, then for them actually it is more mortality disadvantage compared to the other categories. And this is more prominent for those households where the economical status is also further lower. And given this share of widows in total population, as the 2050 US UNDP report very clearly suggests that we are going to expect almost 80 million widowed population in India, we need to keep in our mind that the policy and program should be in the line considering the needs, just not at the individual level, but at the household structure level, at the family structure, at even the intergenerational aspect, how that can actually trickle down the benefits, and that can affect the health, ultimately the mortality for the older widowed woman. So with that, I will end my presentation, and thank you.
Thank you so much, sir.